Well, folks, welcome back to Senate District 2. This is your State Senator Bob Hall, and on one of our favorite subjects, and I don't mean that because I like it, but it's because of what we're having to deal with and the life-changing impact the COVID has had on all of us. And as we move through this, we're in a stage now that people need to be aware of what's actually happening in our hospitals. Up until now, not a lot has gotten out about what's being done. And as you know, if you followed this, the establishment medical organizations, the hospitals in Washington have treated the COVID as though the only solution is to go into the hospital and get on a respirator and then a ventilator. And then they introduce a drug called remdesivir, which the doctors that really understand it recognize that remdesivir is probably the thing that is actually killing the people that are then later labeled as having died of the COVID. Most people don't realize that remdesivir was first brought out to treat Ebola patients, but they had to stop because more people were dying from the remdesivir than from Ebola. So they stopped, put it, to end it. And then how in the world it got back out into the medical community as a drug to treat COVID patients is going to be an interesting thing when history reveals what was covered up to bring that out. But unfortunately, it has been, and it's still out there. But people are trying to get the word out. I can tell you now. Now, also need to tell you that I'm not a doctor. And I'm not here to give you any medical advice. My guest here that is with us today, she's not a doctor either. She's just going to tell you about her experiences. I will tell you what doctors have told me, and I can tell you what I will do, and what my family will do. And I can tell you one of the absolute promises my wife Kay and I have made to each other is that should we get the COVID, that we are not to go to the hospital. We're to go to a doctor who will actually treat us. But if we happen to get in a hospital because of other reasons, as happened with one of our previous guests who had a heat stroke and ended up in the hospital, if that would be the case, to get us out as quickly as possible, but to absolutely insist that we not be given remdesivir and that we not be put on a ventilator under any circumstance. And that if the hospital disagrees with what we're saying in the request for therapeutics that actually work, then we're to get the other one out of the hospital on hospice, to go home where we can bring a doctor in who will actually care about our health and will actually treat us, get us away from the hospital. And so what we've got here today, Jody Carroll, who has unfortunately had a very unhappy experience with her mother, and she wants to tell us about her experience in what happened and what didn't happen. So Jody, thank you very much for calling us and being willing to tell other people about your experiences so they can learn from it and not go through what you did. So thank you for being here today.
Thank you, Senator Hall. I appreciate the opportunity. Thank you for giving me the opportunity to share on behalf of the Carroll family about the experience that we had with my mother. I'll start from the beginning and give you a timeline, and then we can fill in some of the blanks. My mother started experiencing what she described as allergy symptoms at the end of June, and she did wait at home a few days before she realized it was exacerbating. And so she asked my father to take her to the emergency room. They drove to College Station, Baylor Scott and White, Rock Prairie, where they tested for COVID. My mother tested positive, my father tested negative. And at that point, the hospital explained to my mom that she had waited too long to be treated and that they gave her a prescription for some medications. This was over 4th of July weekend, mind you, so there wouldn't be the ability to fill those prescriptions until the following Tuesday. They told her.
Let me ask you a question there. she went to the hospital. They tested her. That was the first time she had tested positive for
Correct.
COVID. And they immediately told her she had waited too long
To be treated.
to
That
be
w-
treated. Okay.
Sure. And that's one of those comments that continues to roll around in my mind. It indicates a medical team or a hospital that doesn't understand that this is a fast moving, serious, deadly disease that needs to be treated sooner rather than later. Nevertheless, my parents went back home, and they had told her if she worsens to come back. In fact, she did, because by the next morning, her blood oxygen concentration was 70. And as you know, normal range is between 95 and 100 for you and I. So they rushed her back to the emergency room. Finally, the hospital did admit her on July the 5th. From July the 5th to August the 1st was one of the most desperate, anxiety-producing journeys to save my mother's life that my family has ever experienced. We found ourselves trying to climb a huge mountain of protocols in the hospital, understanding medicine, understanding science, understanding dimensions of the disease. What we did note was that early on, they put her in the COVID wing, and they immediately assigned her a palliative care doctor and put her on supportive care. What I came to understand was that supportive care is a euphemism for hospice. So immediately, what that tells me is that they were unaware of treatments, or they did not intend on applying medical treatments that save COVID patients' lives. So we began forming relationships with the doctors and the nurses, listening, gathering information, asking questions, getting feedback from the doctors. And we saw that she was progressively struggling with her breathing. So she began at 4 liters on the nasal cannula, progressed to 16, progressed to 30, to 60. Eventually, she progressed to the BiPAP.
And this it were they, what therapeutics were they offering? Was they offering budesonide, ivermectin, hydroxychloroquine, oxycillin, any of those things that that the doctors that are outside of a hospital, many of who have demonstrated over and over again, or what you give a patient with COVID to bring them to treat the symptoms, to treat the lung infections, to treat the blood clots? They didn't do any of that?
No, thank you for the question. In fact, we were told, as we began probing, we were told almost in a script-like format that they would follow the CDC guidelines, and these other treatments that we were asking for, the science didn't bear it out. If I heard that sentence once, I heard it a dozen times. The science doesn't bear it out. The science doesn't bear it out.
One of the biggest and many lies that have been told by Washington and the medical community of the century. And I think history is going to remember this as a very, very dark period in which Americans lost confidence in the medical community because of their lies.
I gave them the benefit of the doubt that they were not familiar with the science. So in my naivete, I went home and I printed out multiple scientific studies, including the bird study, the icon study, printed that out and drove it back to College Station and put it in the hands of the medical team. And I said, here you go, here's the science. This is the rationale for what we're asking for. And by the way, Senator, I do want to clarify that once we understood that the hospital was taking a passive, cautious, wait and see approach to treatment, we went outside the hospital to get a second opinion. And we consulted multiple doctors, including one of the nation's, if not the world's leading experts on treating COVID. And we were given instructions on what my mother desperately needed. Now, it's important to note that my understanding, and again, I am not a doctor, but my understanding is COVID is not a one drug disease. And a lot of people try to equate ivermectin and COVID, but it's actually a sequenced multi-drug disease, just like HIV would be. So there needs to be a lot, if you want to call it a cocktail of medicines to treat a multitude of problems that are going on in the patient.
Right.
And so our outside doctor was advising us, she needs to increase her anticoagulants because thrombosis is going to be a major problem. That's the reason why they cannot breathe. No amount of nasal cannula, BiPAP, and ventilator are going to help her breathe with this microthrombosis going on. And so from the beginning, while my mother was still awake and cognizant and communicative, we were asking for an increase in aspirin. They were only giving her 81 milligrams, which was the equivalent of a baby aspirin. And they were giving her 20 milligrams of Lovenox. Eventually, we did get that pushed up to 40 milligrams. She needed double that dosage. It was simply insufficient to coagulate her blood. And as morbid as it sounds, we have the autopsy to prove that one of the contributors to her death was a failure to properly coagulate the blood. So these were not medicines that were, these were tried and true, as you had said. One of our doctors commented that, Jody, there are patients in that hospital on other floors with different diseases that are receiving full dosage of aspirin, that are receiving full dosage of Lovenox, that are receiving colchicine. So it was very conspicuous that only because she was a COVID patient that there were these series of excuses why they would not give her the proper dosages. So as we began to experience resistance, we went in, we were very polite, we were professional, but we were persistent. And over the course of that month, I began to realize that's what they really did not like or appreciate, was the persistence in our requests. So what we began to do was escalate the level of pressure we were putting on the hospital. When a polite request was denied, then we went and asked for an ethics consult through the chaplain office. We never received an ethics consult, and that is part of the code of conduct with Baylor Scott and White, that they will consider the family values and wishes for treatment if there's any kind of disagreement.
So you're telling me that the Baylor Scott and White refused to allow you to have an ethics conference with them?
Yes. And our understanding is that when a family is dissatisfied with the level of care, that the medical team will come together, whether in a Zoom, telephone, or face-to-face format, and hear the family's requests. We were not able to pull the medical team together ever at any point. It was asking one doctor being denied. Eventually, we also did speak with the chief medical officer of the hospital, who promised that he would have a conversation with the hospitalist. We gave him our list of medications, the dosages, and the reasons why we wanted it. Although that should not be required, we were prepared with that information. And he promised that he would call back and give us an answer one way or another. I can tell you to this day, 6 weeks after my mother's death, that I still have not received a call back from that chief medical officer. Instead, he called one of our family members, who was a personal friend of his, who told another family member, who told my dad, who told me. So I don't know HIPAA law, but to me that seems awfully suspicious. That
most certainly is very, very unusual and probably out of line. But the most disappointing part about it, that is the attitude of ignoring the family and ignoring when you provide them with very clear information and about what should be done. And that's one of the things that's been very, very frustrating to people about it, and very, it's almost mysterious to me how hospitals have taken such a strong stance against treatment that would be effective. Now, I know that there's a great financial incentive given to the hospitals to give remdesivir and to put people on a ventilator. There are bonuses that they're paid, and there's not a lot of money to be made in the therapeutics that are out there, because while they're very effective and safe, they're also very inexpensive, and they kind of get in the way of the more expensive things that the hospitals make more money off of. And so, it's one of those things that you hate to believe or hear, because we used to have such great confidence in the ethics and integrity of our medical personnel. I mean, that the doctor says it, that's what the doctor said. And so you could, take that to the bank. And today we're in this strange world where it's very difficult, if a doctor works for a hospital, to believe anything they're saying today. And I think that's what you're telling me you encountered with
I agree with
Scott
you.
and White in College Station.
I agree with you, Senator. I think that, as a society, we have been trained to trust those in a white lab coat, trust those with high-level degrees, those in authority. And we want to be able to rely on our authorities. I can only tell you that after this firsthand experience that, we need to take off the rose-colored glasses and begin thinking for our own selves and taking responsibility for our own health, doing our own research, and most importantly, being an advocate for ourselves and our family members.
Oh, absolutely.
If you are not questioning, if you are not reading, researching, and verifying to the best of your ability what medication is being administered, how much, to what degree, what the plan of care is, then you're going to be left in the dark, and this freight train of death is going to steamroll right over your family. Oh. I did learn in the process some interesting facts. And one of those was that only 8% of medications used in a hospital are actually proven. 8%. The other 92% of medications administered are based on 3 factors. Number 1, the safety profile. With ivermectin, for instance, ivermectin has a better safety profile than Tylenol, which my mother was on within the first hour upon her admission. Secondly, medications are administered based on signal of benefit. And we know that there is plenty of research out there now supporting the use of ivermectin, colchicine, blood thinners, and the tocilizumab and all these other medications that are used effectively to treat and heal COVID patients. The third factor used to administer medications, this 92%, is based on clinical judgment of the physician, meaning they're able to go out and do research beyond the walls of the institution that employs them. We're talking about the broader global medical community. What is working across the board for other patients? Doctors have this free will in this arena to utilize their clinical judgment based on objective information and subjective information. What is your gut? And we just found in our case that there was not an excess of clinical judgment. That might be a nice way to put it.
So what you have doctors who are giving orders on what they're to do and how they're to do it in treating the patients there. And they're told what they're allowed to do and what they're not allowed to do. And that's what I think one of the problems that we have, that I don't know how we're going to solve this, but when doctors are captive to the hospital, which is something that has morphed over the number of years as hospitals have moved from being benevolent organizations to profit centers, in which they hire doctors and then they line up and give them instructions on what they can do and cannot do. And just makes you wonder how many other people we have that are dying in other diseases and in other ailments because the doctor wasn't allowed to think outside the box, was not allowed to use their judgment, was not allowed to use what they were trained to do, but it could only follow a menu of prescriptions that came down from the financial officer of the hospital, but based on, what is it going to cost the hospital and how do we get that reimbursed? So that you end up with what we have, or is this going to be out of line with what Washington CDC has said we should do, which most people don't realize that CDC is not a government agency. It's a private corporation that's actually funded by the pharmaceutical companies. And so when they say they're not following CDC, what they're saying is we're not following the dictates of the pharmaceutical companies, which are in line to make a huge amount of money by using their drugs like remdesivir and the others that they've developed, the very expensive vaccines that they're now making billions of dollars off of. And so we have our hospitals there that just follow the guidelines like that are coming from the profit-making pharmaceutical companies. And your mother and others are the victims that are out there.
We did get a definite sense that when we were interacting with the medical team, physicians and nurses, that it was more robotic or scripted answers. We could tell that we weren't really getting anywhere. And so we did escalate, and we asked an attorney to help us with the right to try legislation, which you may know, the
Yes.
Right to Try Act from 2017 allows patients in a critical, terminally ill situation to try experimental drugs. You probably have a better way of describing that than I do.
I was there. I was a supporter of that bill. I was very glad to see it. I believe it was carried by my good friend, Senator Paul Bentoncourt. And we passed that. And our intent in doing that was that patients in exactly the situation your mother was in that said, okay, well, that we can't find it. We don't have a solution, that doctors would be able to reach out and say, well, let's try this because I think this might work. So it's very unfortunate. The problem that we're now seeing with the way we did pass that bill is you had to have a doctor that would agree to using that particular technique. And then because the hospital gave them directions otherwise, you don't have many doctors with the courage to go back to their bosses and say, I really would like to try this because I think it would work. They are much more afraid about keeping their jobs and getting their paychecks. So they just say, yes, sir, boss man, that's what I'll do. And
well,
so,
we were really hopeful when we presented the right to try, after asking nicely and escalating to the executive level. That didn't work. We thought, well, we've got this legislation on our side. Mom qualifies on every account for it. And what I really appreciated about that legislation was that it indemnified the hospital of any harm. We told them, we will not sue you. We will not pursue any kind of legal action. If you do go ahead and administer these drugs and it doesn't work, or it causes her harm, even death, we will not hold you accountable. We thought we've removed every single obstacle there could possibly be. Now they'll do it. And yet they refused it. I think it was less than 24 hours they gave it any thought. And so therefore that forced our hand, and we had to escalate to the next level. And that's when we hired an attorney and filed a temporary restraining order and a temporary mandatory injunction, which is essentially the courts mandating, if you will, the administration of this medication we're asking for. I want to remind you that one of the things we were asking for was simply give her 325 milligrams of aspirin instead of a baby aspirin. This is not controversial. If they wanted to concede or show cooperation on any level, they would have at least said, okay, we'll give the 325 milligrams of aspirin. No, they took us to court and fought us tooth and nail. They had a litany of reasons why they could not assist or cooperate with the family's wishes.
So they were determined to have their way, and it was their way or the highway as far as they were concerned. There was no consideration of the well-being of the patient.
Quite the opposite. And I think one of the things that still just rubs my heart raw was the fact that in court, they drew upon the Hippocratic Oath. And as you know, the Hippocratic Oath is a vow that physicians make to do no harm. First, do no harm. from our estimation, withholding life-saving medication is certainly doing harm.
Absolutely.
There is failure of commission, doing the wrong thing, and there is also failure of omission, failing to do the right thing. And that's what we feel that Baylor, Scott, and White did. They failed to do the right thing.
No, that's quite obvious. And they really didn't care about doing the right thing. They just only, what I'm hearing you say here is they only cared about having their way, being in charge and making a decision that was in line with what the big pharmacy companies wanted them to do.
I'll be honest, to this day, I still roll around in my mind what could motivate an organization, especially an institution that is dedicated to health and healing. What would be that motivation? I have not come to any conclusions. Maybe I am naive. I can only tell you that they would not budge 1 inch or concede with any of our requests. There was a reason based on no cause of action. Another reason was no probable right of recovery. There was a comment made that the manufacturer of ivermectin didn't intend it for this purpose. There was also a reason, I'm sorry, go ahead.
That's such a lame excuse because as I understand it, about 80% of the drugs are used for something other than how they were approved by the FDA. That off-label use of drugs is a very common part of responsible medication, responsible medical treatment. Doctors use drugs off-label all the time, and it's very accepted practice. It's not alternative medicine. It is mainline medicine with doctors using their medical skills to assess what the individual how that drug might interact with what they've learned about the individual with the disease that they're particularly addressing. So it's amazing that they would have brought that or used that as an excuse, and very sad.
One of the most common rebuttal that we received when asking for these cocktails was, is in particular in relation to the anticoagulants, was, well, if you overcoagulate the blood, the patient will have a brain bleed or a stomach bleed. And there was some graphic language used in there, I think, to scare us or intimidate us away from asking for that. But in our minds, in the words of an infamous politician, at this point, what difference does it make? She's dying anyway. And
Yes.
We're not going to hold you accountable if she does die. And so, appreciate your concern, but we're making that decision at this point. We wish that it was in a collaborative fashion, but if you won't go along with it, then simply honor the family's request.
Mm-hmm. And what you described was when the doctors were talking about what alternative does the family have. And they came up with saying, well, one alternative is to take the patient out of the hospital on hospice. And as they described it, the hospital can't refuse you to do that. Matter of fact, they will have to transport the patient back to the home along with any oxygen or life-sustaining medications they're giving them at that time. And you take responsibility for it and you take them out on hospice. And then you have a doctor that's outside the hospital who is willing to treat the patient there to take it up. And if you've made a mistake and they're too far along and they die, their description was, what difference does it make? Because they were on the course to die in the hospital.
Right.
The only difference I can see is that the hospital won't make as much money by keeping them there until they die. And so, but that has been suggested as an alternative for those folks that are listening here. If you find yourself in the situation that Jody did with her mother, and a hospital absolutely refusing to do anything meaningful to take care of the patient, you've got an alternative that you can step up and say, okay, I want to take my father, mother, whoever it is. We're going to take her out of the hospital. We'll sign whatever papers you want us to, relieving your responsibility, but we do it under hospice. And that way you at least have a chance. And it may or may not work out, but at least you're doing something that you feel, is a better chance than what she has of just being there, laying in the bed on a ventilator, waiting to die.
Correct. Yes, we obviously have learned a lot post facto, and that's a hard reality to live with. But in the course of what was happening, we did have the presence of mind that, let me just back up and say, we are not a family of medical professionals or legal professionals. My family are business-minded problem solvers. And for us, it was very easy to see and rationalize that if what you are doing is not working, wait for it, try something else.
Right. Well, that's
Right.
just the classic definition of insanity, doing the same thing over and over again, expecting different results. And if you keep pumping that ventilator over and over again, thinking it's going to make a difference, I think the end results we've had now months and months of realizing that a person that goes onto a ventilator is most likely not coming off the ventilator alive.
Right. And so in the midst of our flurry of activity, I was trying to accumulate the data. What is Baylor Scott and White's success rate, meaning COVID patients that walk out, compared to, let's say, these outpatient doctors that are preventing people from even going into the hospital? Or let's compare success rates between Baylor Scott and White and another hospital such as HCA Healthcare in Houston, where Dr. Robin Armstrong works and does utilize some of these creative alternative treatments. Let's compare the success rate between these two hospitals. Obviously, every second counted during that month, and we did not have time to do a great data analysis. But we did try to transfer her. Unfortunately, you have to be at a certain level of stability to transfer a patient. Dr. Armstrong had agreed to receive her, and we started that conversation. But before we could get anywhere with it, Mom went to the ICU and she was ventilated. And so at that point,
it was too late.
It was moved.
And it backs up, all the way that everything that appears to be doing when people contact the hospital, it's all too little, too late. I mean, the initial and your story isn't, unfortunately, your story isn't the first one of the many, many people I've talked to whose prescription basically said, I went to the ER, I went to the hospital, the ER, wherever it was, they tested me, I tested positive, they checked my oxygen, and they said, yeah, you have COVID, but you're not sick enough yet. Go home and come back when you're sicker. And when they come back sicker, it's too late. They're already on a path because, as you said, COVID moves very, very quick. At the first symptoms of it, you think you have nothing more than hay fever or a cold or a little bit of a cough. And in just a couple of days, it drops off the cliff and gets to the point of no return very quickly. And yet that's the time period in which our hospitals are doing absolutely nothing for the patient. I mean, this is the first, I have yet to talk to anybody that says, oh yeah, we had other diseases in which we didn't do anything for preventative or early treatment. This is the first time that a disease has come up that our establishment medical community has said, oh, you can't do anything for prevention, and we're not going to do anything for early treatment. We have to wait until the patient is on death's doorstep, and then we will start administering in the hospital and wonder why we get overrun. When if the hospitals would simply, and the medical community would say, here's what you can do for prevention with your immune system, the vitamins out there that you should have been taking but weren't, A, C, D, zinc, magnesium, K, and the others, and oxycillin, or get with a doctor, and hydroxychloroquine or ivermectin, or just the over-the-counter drugs that have proven themselves to be effective, we wouldn't be facing these things. And it's just but I really wanted folks to get an understanding of what someone like yourself, this is typical of what's happening with the COVID patients that go into the hospital. Those that are fortunate enough to have an immune system that survives the hospital in which they get no treatment, or manages to survive when they give them remdesivir, which I just find it almost unbelievable that hospitals are still giving remdesivir with what we know about it now in being so damaging to the body's organs, particularly the kidneys, that it will cause kidney failure. And with kidney failure, the body fills with fluid. With fluid, you end up with heart failure. You're on a ventilator. And so then they say, oh, they died of the COVID. When I think in reality, we're going to find when the truth comes out that the hospitals are killing these people with remdesivir. It's not the COVID. And the bottom line is where we are today is more people are dying from hospital policy than they are from the COVID. People are dying because hospital policy is refusing to treat the people the way they should be. And then they're blaming it on the COVID, when in reality, it's a hospital policy that's actually killing people.
I would not disagree with that assessment. Since my mother's death, I've begun volunteering for the Truth for Health Foundation, who helps to educate the public about early treatment and early hospital treatment as well. And, one of the points made through this body of amazing doctors that are educating the public is that there are really 4 pillars of treatment out there. And the first pillar is masking, and the last pillar is vaccines. Well, there are these 2 critical pillars in between, which is prevention and early hospital treatment. And that is where we really need to focus on educating the public that there is prevention and there is early treatment. You do not have to die of COVID if you are adequately educated. For instance, my 79-year-old father and I have banded together. We have created for ourselves COVID survival kits. And so we have in a plastic tub everything that we would need should either of us begin to get the sniffles. And that's everything from the inhaled budesonide, prescription of ivermectin, and many of the over-counter treatments, plus a pulse oximeter, a thermometer, and anything else, including instructions, dosages, all written out, and local facilities in our area that actually treat COVID. Because the last thing that you want to do when someone in your family gets sick is go into panic mode and say, oh, well, I'll just trust the hospital. No, you do not want to do that. You want to be prepared ahead of time. So I've made my information available in another context, in another interview, where families can reach out to me, and I will share the facilities that I know that treat, as well as the early treatment protocols from the Truth for Health Foundation website. And it's our small part to make sure this doesn't happen to other people.
Oh, that's great. Now people can find this on a website. Is there a website you have? Or
I don't have a website.
Information.
If someone wants to email me, I welcome any and all contact at the email address. You can keep it at protonmail.com. You can keep it at protonmail.com.
Okay. Well, we'll put that up on the screen here for people so they can write it down and contact you to get the list and what you have learned.
Great. Yes, I would welcome that.
Okay. Well, thank you so much for sharing your story with us. Is there any last thing you'd like to say before we let the folks go here?
I think that's it. I appreciate the time. Thank you for giving us the opportunity to share my mother's story.
No, and I will say is thank you so much for sharing it. And I can tell you that your mother's story has reinforced my commitment. Again, I'm not a doctor, and I'm just telling people what I would do, but I can tell you under no circumstance would I go to a hospital today for anything that was short of life-threatening. And particularly if other than the COVID, it absolutely would not go. But if I did end up in the hospital, I would absolutely refuse remdesivir and the ventilator, and would have whoever was there, was one of the kids or my wife, Their mission would be to get me out of the hospital as quickly as possible to home, if it was under hospice or whatever it is, where one of the frontline doctors who actually cares about their patients would be there for treatments using the therapeutics that we know absolutely works.
Yes,
And
sir.
so, Jody, well, thank you so much
Thank
for being
you.
with us. God bless you and your family. My heart goes out to you, for
Thank
your
you.
loss. And folks, I hope you listen carefully to Jody's experience, because I hope you don't have the same experience. I hope you've learned from this what you can do, what your alternatives are. So thank you for being with us.
Thank you.
And if you think this was helpful, share this post with as many people as you can so we can get the truth out. In the meantime, God bless you and God bless Texas.